Today, we're going to talk about 5 really common things that we see that we know harm mental health that we want you to avoid. I'm Dr. Nichelle Gaines,
I'm Dr. Kristen Lassiter.
and this channel is Medical Mamas. We give you the real deal information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
Based in science. Okay, today we're going to give you our top 5 things that we want you to avoid in the postpartum period because we know these things can negatively impact your mental health.
And we see them all the time in people who are coming to us with mental health problems postpartum.
These are not judgments, right? We genuinely want you and our patients and even ourselves, we're not postpartum, but these all apply to everyone. We want you to feel better. And so if you notice some of these things, they may be action points for you to help you feel better.
Absolutely.
So I think definitely the first one is substances. So that includes alcohol and illicit substances. I know that marijuana or THC in some places is not considered illicit, but we want to keep that in that category.
Yeah, because we do know that for the vast majority of people, using THC can harm mental health or make their mental health symptoms worse.
Mm-hmm.
And so even though there's lots of controversy around this, if we're just looking at the evidence, that's what's there.
And then specifically for alcohol, we know that it's definitely a big part of our culture. And I think that's changing a little bit, right? Seeing more mocktails on the menu and having more people who are super curious, but it's part of our culture. And it seems to be a more accepted way of kind of dealing with your problems, like mommy wine time, or, oh, I need a drink at the end of the day, or something like that. And the reality is that alcohol does not improve your mental health, but it may for the short term while you're on it or while you're intoxicated, you might feel a little bit better. But what ends up happening is the next day that you will notice some effects of like feeling more anxious, or your sleep might be disrupted. Even though you feel like it maybe is not disrupted, it definitely is disrupted. So that can be really impactful negatively for your mental health.
Yeah, we see that people who use alcohol, and then if we're looking at their sleep pattern, they actually, while they do fall asleep faster, they don't go into that deep sleep that's really restorative for your brain.
Right. And then they wake up sort of withdrawing from the alcohol sooner because their body is like, hey, this doesn't feel good. And so the sleep even later in the night is disrupted as well. So sleep is definitely not great on alcohol, even though you may feel like, oh, it's just so, now I can fall asleep so easy. It's just not great for your sleep.
And then that leads us actually to sleep, right? Getting good sleep. People don't prioritize their sleep postpartum, or they kind of think, oh, I can't sleep anyways, or, I need to be the one who gets up all throughout the night because my partner has work, or I need to get all this other stuff done during the day when the baby's sleeping, like I can't rest. But, we really need to be prioritizing sleep in the postpartum periods.
Right. So the thing we want you to avoid for this is chronic sleep deprivation. That ideally you're getting 7 to 8 hours of sleep in a 24-hour period. And hopefully, we know babies are not upward with this plan, but hopefully you're getting at least 5 of those hours in a row. And over time, we're just reaching for that goal.
Yeah. So hopefully getting uninterrupted sleep for at least 4 to 5 hours. And so if that means that maybe you split up the night with your partner, or get some other extra help if it's there with grandparents or hired help. Yeah. Like just making sure that you're really prioritizing your sleep.
Okay. Number 3, I would say just kind of umbrella thing, like stressful situations, right? And it's not always completely possible to avoid all stressful situations, of course, but the ones that are under your control, like toxic relationships, maybe setting some boundaries, especially with your partner. If you need to go to couples therapy, that's definitely going to be helpful moving forward, because we know there is a correlation between specifically marital stress or marital discord and postpartum depression.
And then making sure that you're limiting as many toxic situations as possible too. If there's a particular thing that is not going to be good for you, don't do it. Don't feel obligated. This is a time when you really need to be focusing on your mental health because that's what's most important for your baby's growth and development.
Absolutely. Okay, so number 4 is going to be ignoring the symptoms that you do have. And this one is absolutely huge. It is really easy to do. And I will say, sometimes we are the last ones to know that we are feeling bad, right? We just know that we feel
Absolutely.
off, or we think that, like, oh, this is supposed to be normal, or it's all in my head, or something like that. There's a lot of different things that
Or
chemicals.
a lot of people think like, oh, it's not going well for me because something's wrong with me. Like I'm not trying hard enough, or I'm not a good enough mother, or everyone else can do it except for me. Like something must be wrong with me. But these are common things that mental illness will tell you that actually aren't true.
Exactly. So don't ignore your symptoms. We have plenty of videos on what the symptoms of postpartum depression are, and I will link those in the comments or the description. So please watch those. Do not ignore your symptoms. That is so, so, so important. And that sort of leads us to the next one, which is
Don't stop your medications postpartum, assuming that your doctor has told you.
right, right. And then also, if your doctor talks to you about stopping your medications in pregnancy or postpartum, you want to ask them why, right? Have you thought about what the risks of depression, anxiety, bipolar disorder, ADHD, whatever you're treating are in my situation? We definitely know that there is an association between stopping medication and recurrence of illness and worsening of illness in the postpartum period. So if someone tells you to stop your medication, you definitely want to take a pause there and make sure that you have all of the information. And then please don't stop your medication yourself, right? You want to make sure you have someone who's helping you through this process to know what's right for you, because sometimes postpartum, sometimes when we're depressed or anxious or experiencing something, we're not quite thinking the way that we would normally think about we're supposed to feel good and we're allowed to feel good and those kinds of things. So
Yeah, or sometimes people will start medication postpartum or in pregnancy and they're feeling better. And so then they're like, oh, I think I can stop it. Or I don't want to be exposing my baby to this via breastfeeding. So I'm going to go ahead and stop it. And in reality, that postpartum period up to 12 months after birth is a high risk time for mental illness to come back, especially if you've had it in the past.
So those are our top 5 things to avoid in the postpartum period to make sure that you're supporting your mental health. Please like, comment, subscribe. We'll see you soon.
Bye.